Why do we take medications at specific times? Have you ever wondered why your doctor or your pharmacist gives you very specific instructions on when and how to take your medications? Morning, evening, with food, before bed, after waking up 30 minutes before having breakfast? I can understand it can get oddly specific and honestly annoying at times, right? But let's dive into the science behind why medications must be scheduled so strictly. Pharmacology, if I'm being honest, wasn't my favorite subject in medical school, but it is important to go over some basic principles of pharmacology to really understand why medications are dosed the way they are. First is half-life, which is defined as the time required for the concentration of a specific drug to decrease to half of its initial amount in the body. So how this works is when you take a medication orally, the drug is slowly absorbed into your blood and its concentration increases until it reaches a peak, and then it slowly decreases as the drug gets metabolized. So let's take ibuprofen for example, which has a half-life of around 2 hours. So let's say you take a 400 milligram tablet at hour 0, that gets 100% absorbed into your blood. In reality, not all 100% is going to be absorbed when it's taken orally, but for the simplicity of today's discussion, we're going to make two assumptions. First is that all 100% of the orally taken drug is absorbed into your bloodstream, and second, quantity equals concentration, just to keep the numbers a little clear. So, you took a 400 milligram tablet at hour 0, it'll reach its peak concentration in your bloodstream at 2 hours, so that'll be 400. At 4 hours, only half of that concentration will remain in the bloodstream, so that will be 200. By hour 6, it will be 100, and by hour 8, it will be 50, and so on. The next concept is therapeutic window, which is the range of doses at which a medication is effective without unacceptable adverse events. So, depending on the half-life of the medication, it is dosed at regular intervals, such that a steady concentration of the drug within the therapeutic range is maintained in your body. This is the reason why if you are told to take a drug twice daily, you cannot just take 2 pills at the same time and be done with it. You double up, you risk overshooting and going into the danger zone. And if you do miss a dose, you might risk dropping below that effective level and not getting the needed effects of that medication. Now, some medications are also scheduled depending on the time of the day. This is because our body follows the circadian rhythm, and so many of our body functions differ depending on day versus night. The circadian rhythm can affect our core body temperature, our cardiovascular function, our digestion, hormone secretion, and even how we metabolize drugs. For example, cholesterol synthesis in the liver peaks during the night, which is why statins, which are the class of drugs that are used to control high cholesterol levels, and especially short-acting statins, are often prescribed for evening doses. All of this is further complicated by how the drug itself functions and how it interacts with our body. Some medications are prescribed based on their side effects, and the timing is optimized such that the side effects are alleviated. For example, some medications are scheduled based on how they affect our sleep. Medications like antihistamines can cause drowsiness and are recommended to be taken at night, while some have stimulating effects and are better taken during the day. Now, other medications need to be timed to match our hormone cycles. So let's take insulin, for example. Insulin is a naturally produced hormone that controls our blood glucose levels. When our blood sugar spikes after meals, this triggers the pancreas to release insulin. In patients with diabetes, this process is impaired either due to insulin deficiency or insulin resistance, and that is why insulin is often administered around meal times to mimic the body's natural response and help control post-meal blood sugar spikes. Similarly, cortisol, which is a naturally produced steroid hormone by our adrenal glands, follows a circadian rhythm, so it typically peaks in the morning around 6 to 8 a.m. and gradually tapers throughout the day. To mimic this natural cycle, patients with adrenal insufficiency are often prescribed corticosteroids to be taken early in the morning to align with the body's biological rhythm. Now let's talk about why some medications need to be taken with food. This usually means one of 3 things. A. It helps the medication absorb better, like fat-soluble vitamins A, D, E, K. B. It prevents stomach upset, like many antibiotics or painkillers like NSAIDs can increase acid production in our stomach and cause heartburn. And C. It can reduce nausea or irritation caused by some drugs. Other times, you are recommended to take medications on an empty stomach. This is because food can disrupt the absorption of certain drugs. For example, synthroid or levothyroxine, which is used for hypothyroidism, is recommended to be taken early morning on an empty stomach. So in conclusion, when you take a medication, the timing can influence how well your body absorbs it, how long it stays active, how effective it is, and how likely it is to cause side effects.